Hi, my name is Julia Flack, and my topic is going to be focused around the inequalities that women who have a physical disability experience in the healthcare settings. So, an individual can be born with a physical disability or acquire one later in life, maybe due to trauma, illness, or an injury. And it can result in limitations in mobility, functioning, dexterity, and stamina. So, women who have a physical disability face inequalities in the healthcare setting, which appear as barriers. And these barriers include transportation, meaning that the women are dependent on another individual to take them to and from their appointment. And the equipment used in the office is inaccessible to their needs. And lastly, women who have a physical disability have reported that they do not feel supported by their healthcare supporters. And that there's a lack of communication between them. So, a topic such as this one should be brought to society's attention because women who have a physical disability are not having the same opportunities and experiences when attending preventative screenings. However, in our society, when someone has a physical disability, they are seen as a burden and they are labeled as being dependent and complicated since they require more accommodations. So I'm now going to be addressing some of the barriers that are present in the healthcare setting. So when women are pregnant and have a physical disability, they are stereotyped as being asexual, and for this reason, they're not thought to be a mother. So when women with a physical disability have had society take away their traditional role of being a mother, the healthcare providers in the education aspect of their field of work, these women are not talked about, and therefore the healthcare providers do not know how to accommodate the women's needs due to their disability. And then also it has been noted that during the pregnancy, if a female is wheelchair bound, this can result in a lot of issues because eventually she may not fit into her wheelchair. She may have maneuverability issues and stability, which could result in injury. And because of insurance reasons, it's actually very difficult to require a new wheelchair during the duration of a pregnancy. And now I will be focusing on another preventative screening. So for breast cancer, women will attend regular mammograms, and this is a tool that's used by doctors to screen for potential breast cancers and monitor women who have been previously diagnosed. Yet, unfortunately, when women have a physical disability, they're actually less likely to continue to attend these regular appointments due to the fact that they had a very uncomfortable experience the first time they went. And this is because the machine that is being used to conduct the mammograms was only built with women who are able-bodied in mind. So for this reason, the machine is very inflexible, and the women who have a physical disability are actually having to compensate for the lack of flexibility, and they're having to maintain these very uncomfortable positions. And then another preventative screening for women is having regular cervical cancer screenings once they are a certain age. So women have a physical disability have issues with this examination since the examination table is not height adjustable oftentimes. So with this, if the woman is wheelchair bound, she could have a lot of issues from transferring herself from the chair onto the examination table. And as I've said, the healthcare providers really are not educated the way they should be about physical disabilities. So they're not trained properly in how to aid the individuals on that transfer process. So this also could result in injury. And then another issue that arises is that when women have a physical disability, they've actually been shown to fall into a lower class population and have lower levels of education. And so with this, when they are attending these appointments, if they do not have someone to take them to the appointment, they would then have to pay to attend the appointments, but because they're in a lower class population, they may not have the financial means to afford transportation. And then again, individuals who have lower levels of education lack awareness for the needs of screening. So it's very evident that change needs to be made in the healthcare setting in order for women with a disability to not be exposed to this inequality. So for this reason, I believe that education models should be implemented for healthcare providers to raise awareness about various physical disabilities and how to properly care for these women who have them, and being able to accommodate for them, and having that knowledge so that there can be that open communication. And then in addition to this, I think this is a really important issue, is that the equipment that's being used in the offices need to be inclusive for all individuals and not just those who do not have a physical disability, because we are living in a society where technology is very advanced. So with that being said, machinery and equipment should be inclusive for all. So the sociological significance, I'm first going to be focusing on cumulative disadvantage. So if an individual comes from a lower socioeconomic background, they may not have the financial means to receive proper medical treatments and assistive technology to overcome barriers that are faced in everyday life. And then I will also be focusing on intersectionality. So women face more inequality in the healthcare system because when they have a physical disability, since their type of preventative screening actually requires more technology. And as I've stated, the technology that's being used for these women are not adjustable. So this actually results in a very uncomfortable experience, which causes the women to not want to return. So in conclusion, women with a physical disability are exposed to more physical barriers in the healthcare setting. And these women are also being labeled with a lot of stereotypes, such as being asexual, and they're stripped of the traditional titles such as being a mother and a nurturer. So with this can also just create a lot of stigma within the healthcare system. And as I've noted, there's a lack of education among the healthcare providers on how to care for an individual who has a physical disability. And then the equipment being used is not inclusive for all, and it's only designed for, able-bodied women. Thank you.